Hello everyone. Today's video is about therapeutic options for bacterial vaginosis. As per usual, nothing that I'm saying in the video should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So someone posted this question on one of my other videos, which says, what about using Echinacea angustifolia suppository for bacterial vaginosis, which is what Buhner recommends? Or recommended more appropriately, because the late great Stephen Buhner passed away about a year or so ago. I'm having massive die-off symptoms and assuming it's very effective. So I'm sorry to hear about the die-off symptoms, and I hope everything clears up quickly. This question was posted 12 days ago, so I hope it's long since passed, but still posting this video for the sake of answering the question. And sorry, I didn't get to the video or to the reply faster. Just hard to keep up with all the questions that come in. Stephen Buhner, a wonderful herbalist, and I'm very familiar with his Echinacea angustifolia suppository protocol. To be honest, I think I prescribed that to one patient once over the years, and I believe it worked well. I think it was in combination with kind of an herbal flush as well, and I believe it worked well. But to be perfectly frank, I've been really spoiled in my practice in that I've found a different type of suppository treatment has generally worked really, really well for BV cases that I've seen, and I just really haven't worked with the Echinacea angustifolia suppository protocol before. I believe I recommended it to one patient many moons ago, and I believe it worked well. And quite frankly, I follow a lot of what Stephen Buhner had written in his books. His Lyme and co-infection protocols are second to none. His antiviral recommendations are second to none. So I put a lot of stock in what he says. So just where aside from just having a video saying like, yeah, I've used it once, it worked once, maybe it'll work, probably will work, I will just share what type of suppository I find to be the most effective for cases of BV. And not that I specialize in BV by any stretch of the imagination, but just over the course of time, treating a lot of patients, these questions come up, and unfortunately seem to have a pretty good track record giving advice to help that get cleared up. So the best treatment that I found in my practice, for the most reliable treatment that I found in my practice for BV, is using ozonated oil suppositories. Ozonated oil suppositories are not something that are to my understanding, commercially available anywhere. I basically send my patients instructions how to kind of make up their own suppositories. And again, I can't stress enough that I'm not giving any medical advice here, any treatment advice to anyone, but just for the sake of academic purposes, just so that if you want to talk to your clinician about this treatment for BV. And I mean, a lot of the cases of BV that I've treated have mostly been really chronic cases that have not responded to other treatments. So, for just kind of your run-of-the-mill BV, like, for example, boric acid suppositories can work really well, or there's other preparations that could be used. But for like the really, hard to treat recalcitrant cases, what I found is that these ozonated suppositories have worked really, really well. So the way that I advise my patients to kind of make these is actually combining the ozonated oil, usually ozonated hemp oil, but ozonated olive oil will work too, and then combining that with some coconut oil, or could be something different like, say, shea butter or something else that's kind of going to mix well with the ozonated oil. And then ultimately the patients will either purchase little suppository molds online, or generally, because they don't want to wait for something to ship to them, then they'll just make their own kind of homemade suppository molds, basically making like little torpedo-shaped tinfoil molds essentially. Then they'll kind of spoon that mixture of the say carrier oil, like solid coconut oil or shea butter or whatnot, plus the ozonated oil into the mold, and then put it in the freezer, and within about 10-15 minutes they freeze solid, and then they can be administered as a suppository. And I find that usually, it depends on the case, but usually within a few nights at most, usually they apply them before going to bed, because just for not dealing with mess purposes, that's what they'll typically do. But usually within a few nights at most, we'll see a significant, if not full, resolution of symptoms. Now, for more chronic cases, like really, really tough cases, it might be a good couple of weeks before we see things totally clearing up. But it generally works really well. With some of the really tough cases, patients will have to kind of cycle on and off of them, so they'll kind of use them for a certain amount of time until they're asymptomatic. And then if symptoms start to come back, they'll go back on them for a period of time, and then come off them. If the symptoms come back, they go back on, and sometimes you have to do a few cycles of them, but it can be very, very effective. Generally, the ozone is well tolerated. It's not irritating or stingy or anything like that. And yeah, I've had a lot of success with that for BV, and then also many cases of just regular vaginal yeast infections. Or I've treated a number of patients where they come in saying, like, it feels like I have a yeast infection. It's not like a full-blown one, and I do tests and it comes back negative, and I don't have BV, and like nobody can figure out what it is, but I've had yeast infections before, and like that's what it feels like, even though the test's coming back normal. And so if it's kind of like this, we're not sure exactly what it is, but it seems like there's kind of an infection, there's some irritation. The ozone oil suppositories are just oftentimes a very effective tool to use. They're a little bit of a pain to make up ahead of time, but small price to pay for the therapeutic outcomes that are oftentimes seen, at least in my experience. So I hope that information is helpful. Again, I hope you're asymptomatic, and I hope you don't have to deal with BV again in the future. Yeah, but if you did wind up trying the Echinacea angustifolia suppositories and that worked well, then I'm glad to hear it. For folks that are interested in that protocol, and I'm not sure off the top of my head, I think that the Echinacea angustifolia suppository protocol is in Stephen Buhner's. Let's see if I have the book here on my shelf. I think I have the E version of the book, but it's, I believe, his book Herbal Antibiotics. He's got another book called Herbal Antivirals, so this would be in the Herbal Antibiotics book, I believe, and it's got the whole protocol in there. So thank you for the question. If anybody has any questions on this topic or anything else, just post in the comment section below, and I will do my best to answer in less than 12 days if at all possible, but as per usual, we'll get to the questions as soon as I can.